You're listening to Rewilding Humanity, the podcast for those who've walked through the fire and came back with medicine. I'm Krysta, artist, plant alchemist, and a woman initiated by illness, grief, and spirit. Here, we rise from collapse, reclaim our wild, and remember who the hell we are. Let's get into it. Hey everyone, welcome back. A little bit of a different format today. I'm going to start doing intros again. I used to do those in like seasons 1 and a little bit of season 2 that I managed to get out. And yeah, I wanted to do this just to, share a little bit more about what's going on in my life in like real time. And just a little bit more context on the guests that are coming on. So today, if you're watching on Spotify, you'll notice that my background is a little different today. I'm recording in an RV at my parents' cabin on the lake, and it's sweltering here right now. So if you see sweat dripping down me later in the interview, that is why. But it's been amazing, honestly, being back here. It's really interesting. I haven't felt this good in a while. Like I don't know. I don't know what it is. I don't know if it's the location, the nature, obviously. But I live on a farm when I'm up north. But I have a feeling it has something to do with my human design. I'm a shores person, which means that I thrive next to bodies of water, and being on the lake, it really feels like that, which is awesome. I've been having a ton of downloads and ideas and getting some really exciting things together, which I'll be sharing with you guys at some point. And it's so nice to walk outside and do some foraging. I've been collecting elderberry, and today I went out and harvested a bunch of thistle. I use them for eyes in my sculptures. And yeah, I think I stabbed myself about 40 times harvesting them, but totally worth it. They look so cool. That was actually one of the first things that inspired me to do the artwork that I'm doing now, were the thistles. So I had to go collect some. And yeah, I have some really cool ideas for some new products that I want to create, but I'm going to be doing things differently moving forward. I have just like a few things that are available on my website, but I've actually decided to completely redo my website from the ground up. I have so many different things that I do and I offer, and so many new things that I'm going to be doing and offering. So it's time that I refresh all that and do what I've done for my clients for the past close to 20 years. And actually brand myself and create a space where everything can live. And so it all makes sense. I've been getting a lot of requests for podcast guests, and they're being sent to like random emails, and everything's just a mess right now. So I'm going to work on cleaning all of that up. And another thing that I'm implementing is a new email list. If you want to hear more updates from me, and I'm also going to be sharing something that I don't normally share ever, but there will be some writing. I'm actually writing an article right now that I'm hoping will be published in a magazine. We'll see what happens, but I am writing this article, and as I'm writing it, I'm like, this is actually good. I might have to share this eventually. So yeah, you should sign up for that if you're interested. It'll be a good way to also connect a little bit further. If you have any questions, I'll be offering new content and exclusive things through that portal. So there is a link in the show notes that you can click on and add your details if you want to be part of that exclusive list. And yeah, I'm excited to share some new things with you guys. I'm going to be creating in a whole new way. Like I mentioned, I'm just reformatting everything. And there's going to be really cool drops and collaborations and events, retreats coming up. So I highly recommend joining me there. That would be great. Today, we're talking to my naturopath, Dr. Jessica Eastman. And I'm so glad she decided to come on today. She's been such a huge ally for me on my healing journey. My very first call with her was in the psych ward. I reached out to a lot of people in the psych ward, not really, but a couple. And yeah, she just really helped resource me. And it's rare that you find somebody who is trauma informed, nervous system informed, especially with what I was dealing with, which can be called so many different things, but a sensitized nervous system. She calls it, I think it's central sensitization, which we're going to discuss here. And yeah, it really was a saving grace for me. And I know a lot of people are dealing with all kinds of nervous system things from varying degrees. And so I think it's really important to have her on because she is much more science focused than a lot of the guests on here. She's not into woo, like at all. And she's just a wealth of information. And I think it's really important to take a balanced approach when we are creating our health team, because sometimes that's what we need. We need a whole fucking team. I literally have her, my MD, my therapist. I have a specialist that I'm seeing now for my con syndrome stuff, and have just been referred to another person. It's insane. It's so funny. It reminds me of this astrology reading that I had years ago. And this guy was like, yeah, he's like, you're born under the nakshatra of something, and I don't know what the fuck that meant, but he was like, it means you have a supercharged intellect, because something about like doctors, and he's like, you have a supercharged intellect like a doctor, but you also are going to see a lot of doctors in this lifetime. And I'm like, yeah, no shit. No shit. Yeah, but I have been feeling really great. I think it's partly the location that I'm in right now. Also losing 200 pounds of psychopath. And if you haven't been updated on that whole saga yet, just look back a few episodes because holy shit. And I've also been taking my new product that I developed, Brainbow. You'll hear an ad for it later in this episode, and Jess and I will discuss it. I actually ran the formula past her before we went into production, and she was like, damn girl, this looks good. So yay me. But yeah, I'm just like waking up super happy every day for the past like few days. I've been on it consistently for 2 or 3 weeks, and this is a purely functional product. But yeah, I'm just like, fuck, I'm just like happy for no reason. And I'm just like getting so much stuff done right now. And I don't know. It's amazing. I think it's a combination of all of it. Oh, and all that while I'm in the midst of tapering off of my SSRI. I'm on one psych med left. And I'm like a third of the way off of it. I just made another step down like last week or something. Felt like a little neat yesterday, but yeah, I'm killing it. It's feeling great. Thanks, Brainbow. Okay, so let me do a quick introduction. Dr. Jessica Eastman is a naturopathic doctor. She is also a psychedelic-assisted therapist and trauma recovery coach who helps people heal through integrative psychiatry and holistic mental health care. Her work is intersectional, evidence-based, trauma-informed, and focused on helping people restore their sense of safety, connection to their mind and body, and resilience to life's challenges. And her goal is to help people move forward from living in survival mode, which, like, hi, how many of us are, to feeling safe in their own body, connected to themselves, and resilient in the face of life's challenges. So I've worked with Jess in both of these capacities where we've done naturopathic work and also trauma counseling. And yeah, she has just been such an incredible ally. So I'm really excited for you guys to get to meet her. And let's jump in and meet Jess. Before we dive in, if you love what you're hearing on Rewilding Humanity, pause this episode for 60 seconds to leave a review on Apple Podcasts or Spotify. As a thank you, every month I'm doing a draw for a bottle of my handmade medicinal herbal oil. And yes, it's free shipping worldwide. Just leave a review, screenshot it, and DM me on Instagram. Your words help more people find these conversations, and you might just get some plant magic in the mail. How are you?
I'm good. Yeah, I'm really good. How are you?
I'm feeling so good the past week. I don't know. I talked about it a little bit on the intro, and I'm like, I don't know if it's because I'm at the lake or because I've been taking that saffron product for a couple of weeks, but like I'm just like waking up happy for no reason and like walking around with a smile on my face, and I'm just like, what is happening?
Amazing. I love that for you.
I love that for me too.
Yeah.
Yeah, I don't know what it is, but I'm just like super inspired and I have all of these ideas that are coming to me and I just, yeah, feel friggin' great the past few days. Nice.
That's awesome.
Yeah, a far cry from when we first met.
Yeah. Which, given how recent that was chronologically, I think you're doing pretty excellent.
Right? Yeah. Yeah, I'm
I know it
definitely.
feels like an eternity probably for you, but
Yeah, part of it did for sure. It felt like for a while I wasn't making the progress that I wanted, or there was like a big jump in progress, and then I felt like I was like stuck for a while. But yeah, I don't know. Things are definitely shifting in the right direction. And yeah, it's a lot different than sobbing hysterically in the psych ward. And yeah,
wow.
yeah, yeah.
Yep, it is.
We're thriving compared to that. Yeah.
I mean,
Yeah. So I talked a little bit about that in the intro as well. I think I had a girlfriend who had consulted with you, and I was in the psych ward, and she was messaging me and mentioned your name, and I looked you up, and I was like, oh wow, like it's really rare to find somebody because I wanted to have more support on the natural front. That's always the way that I've gone, and I'm like, okay, I'm being pumped full of pharmaceuticals here, which, I'm gonna need. And that was like really what you said that first day when we had our Zoom call. I was in there and you're like, listen, like you're not gonna get out of this without drugs.
yeah.
So just calm down. Cause I was so freaked out. I was just like, I don't want to be on these drugs. And you're like, it's fine. Like it's not gonna be forever. And it's true. It's not. But yeah, but to see that you were also like trauma informed and all of these things, right? I was just like, holy smokes, it would be so nice to have this kind of support. And here we are, what is it, a year and a bit later. And yeah, you have been a fabulous support. So I wanted to bring you on and introduce you to the audience because I know there's so many people out there that are probably dealing with various degrees of nervous system dysregulation and maybe symptoms that they're experiencing that they don't even attribute to being nervous system. Because that was definitely me. I was like, there is no fucking, I don't know, I'm just possessed. Like, I'm dying. Like, I have ghosts in my blood, and it's just,
Yeah.
like, you're bad. But yeah, things can show up in so many different ways.
Yeah.
But we'll unpack that today.
Yeah, let's do it. I'm happy to be here.
Awesome. Let's do a little bit about you. I talked just very briefly about your bio, but let's talk about how you got into the work that you're doing now.
Yeah, sure. So I was that like precocious little girl who always wanted to be a doctor. And my intention for until I graduated university was to go into neurology because I wanted to study the brain. And I was working in the hospital throughout my undergrad degree, like in the PACU and high acuity areas of a teaching hospital, and getting to watch nurses and doctors and surgeons and surgery and see how they navigate patient care and healthcare. And so one of my earliest cues to direct me towards the path that I ended up going on was the realization that the way that patient care was managed from a conventional perspective didn't fully align with my definition of healthcare. And so that was like the earliest cue of, wait a minute, like nobody's talking about diet or lifestyle or environment or mental health as it relates to all of these physical health conditions. And then I also really realized that the day-to-day of an MD, based on how the conventional system is run in our part of the world at least, doesn't really give those doctors an opportunity to develop relationships with their patients. And that felt like both a really important part of the medicine to me, and it also felt like a big part of how the work would be sustainable for me. And so I did this. I was like in the process of applying to medical schools and not really feeling stoked about it and really feeling confused about that because I had for my entire life been working towards this moment of applying to conventional medical school. So I did this exercise of, okay, what does a day-to-day look like in the life of future Jess as a doctor, and realized that I was not describing what a medical doctor's day would look like, what I thought about it would look like back then. And at that point, I started looking at other options and went to an info session at naturopathic medical school and like pretty instantly was like, oh, this is the thing. Like I get to do a bunch of medical training, but from a holistic intersectional perspective. And so I went through my schooling, loved a lot of it, really didn't align with some of it, just in the way that like there's some old stuff in naturopathic medicine that's not super informed by evidence, which I am like less connected to, but made my way into my internship and was really excited to be working with patients. And I got the privilege during my year of internship to work on a focus shift that was basically like a collection of patients who had, at the time it was chronic fatigue and fibromyalgia. Then it was called myalgic encephalitis or encephalomyelitis, which we are now evolving into our understanding of is actually like POTS, dysautonomia, MCAS, histamine dysfunction. There's a bunch of stuff there. But anyways, that was the label of the shift. And what it functionally resulted in was patients with significant chronic illness that was often undiagnosed. And so there were a handful of patients there that had diagnosed fibromyalgia, chronic fatigue, etc. And there were a lot of patients there that were just unwell and nobody could figure out what was wrong with them. And from the very beginning, one of my biggest draws into medicine has been problem solving and wanting to understand what's going on. And so I went in to this focus shift with a really cool supervisor, like really excited to spend a year problem solving these like really complex patients. And one of the big commitments of naturopathic doctors is to, whenever possible, identify the root cause of what's going on. And to me, that felt like a logical thing that all clinicians should be doing of any type, because that's how you actually figure out how to build an effective treatment plan.
Yeah.
And so I approached this this intern year and this focus shift, trying to understand the root cause of a lot of the dysfunction and disease that these patients were having. And I pretty quickly identified that at the core of a significant amount of the pain, fatigue, insomnia, distress that these patients were experiencing was mental health stuff and like a long-standing presentation of anxiety or depression or burnout, which we didn't have a name for back then, but what we can now identify as burnout. A lot, like my supervisor was like colloquial about it. She's like, "Oh yeah, these patients are always type A people," which is the type.
Yeah, me.
Overworking, driven by anxiety a lot of the time, like an inability to identify like how to rest and how to take care of yourself. And so I was like, okay, that's interesting. And I was working at the time as well at a clinic, an outpatient addiction treatment facility in Toronto. Gabor Mate was on the board of directors. And it was a really holistic approach. It was the first time I had ever seen holistic addiction treatment. And working there, I had the privilege of shadowing and learning a lot from the psychologists and psychotherapists and docs that worked at that clinic, and started identifying, oh, wait a minute, at the root of addiction is also mental health. And these patients had tons of money, but had exactly the same core mental health challenges as the patients that we were seeing at our like low income clinic down the street. And so I graduated and started my practice figuring that I would focus on these complex chronic illnesses, but mostly focusing on mental health stuff, because it became clear I was at the root of a lot of this, and I didn't think that there was a whole lot of effective support from a mental health perspective. And so in my early days of practice, that's what I was really focusing on. But as my commitment to identifying the root cause developed, I was like, wait a minute, I want to understand what the root cause is of anxiety and burnout and this like type A behavior that perpetuates this illness. Trauma. Because at the root of most, maybe not, I'll leave out the qualifiers, at the root of a great deal of mental health challenges and physical health challenges is trauma, especially as experienced in childhood or young adulthood. And the conventional systems, or even the non-conventional systems for caring for, even diagnosing trauma, never mind caring for it, are just abysmal. And that really just pointed towards what I needed to be doing with my life's work, and also really illuminated why there was such a gap between the type of care that gets offered via psychiatry, which is like necessary and life-saving, and the type of care that gets offered in counseling and therapy, which is necessary and life-saving. But neither one of those things were really like bringing about sustainable change in our patients. They were like often helping to manage symptoms. Very rarely was it bringing about cure or even like remission in the way that we were able to achieve in a lot of other medical perspectives. And so that's what landed me to this. And then I spent many years researching and learning and doing more training on mental health and trauma and how that intersects with physical health and addiction and all of the other stuff that comes up in those realms. And that, plus a side of the psychedelic as a tool for mental health and trauma treatment, is what brought me here. So just like a fervent commitment to, I want to understand this, and I want to create support systems and tools that fill the gap that's just like really not, that's really evident and is like leaving a lot of people without appropriate care and support.
Yeah, absolutely. First of all, thank you for sharing that. And I wish every health professional approached their career with that type of curiosity and thinking about how they want their life to look. I know there's so many people in the profession that are completely burnt out themselves, and it's not sustainable. It's interesting because I remember being diagnosed with fibromyalgia when I was in my early 20s. So this was, God, I guess a while ago now, 41. But yeah, it was just a thing. I remember my doctor saying, we don't actually know what it is, so we just call it that. And here's a bunch of, what did he give me? Tramadol. I was taking tramadol daily for it. Yeah. And eventually they just put more SSRIs. Like I was on a bunch of stuff for a while. Like I started getting panic attacks after surgery when I was 16. And then my health just deteriorated into my 20s, and then had all this exhaustion and pain in my body and couldn't function. And so they just loaded me up on SSRIs and Wellbutrin, and it helped a bit. And I eventually got off of all of that stuff, but I had changed so many things in my life at that time, right? Like diet, exercise. I was just inundated with personal growth. I moved overseas to work for a company that was a personal growth company. And so all of those things contributed, but I didn't really understand that at the time. And it is a huge gap still, because even when I was in the psych ward, like my psychiatrist was great, but I'm like telling him about all of my symptoms, which you were like not freaked out about at all. And he's just like blankly staring at me. Okay. Like he was kind and whatever, but he's like, okay, so then we're going to add this drug and let's put an antipsychotic on top. I'm just like, by the end, I was on a lot of medication, thankfully not too high of doses, and I was able to get off of stuff pretty quickly.
Yeah.
And yeah, like that is necessary sometimes. And I know that you do work in that realm as well, but it's paired with all of these other modalities that are often missing. And I've even done just the talk therapy for years and still struggled so much with my health. And now it's like I kind of have this whole I got like a whole team going on. And for people who are dealing with chronic illness at a pretty severe level, which, hi, me, but that's what you need, right?
Yeah.
Which is unfortunate, but it's just how it goes.
Yeah, and I would argue that everybody would benefit from having a comprehensive and holistic care team like that. Certainly, some of us need it more than others. But yeah, I think it's really important. I think that one of the biggest problems in our medical system is that the whole of the system and the people, the professionals within it have been trained to look at one part or one system of the body at a time. And I understand how it happens. And I don't have a magical wand solution. I'm not over here saying, I think this is the answer, other than comprehensive, collaborative care teams, because we absolutely need people who are experts in the brain and experts in the kidneys and whatever. But we are doing people a significant disservice by not looking at the whole person.
I have to tell you about something I created that's been changing people's lives. It's called Brainbow from Mindful Meds. I formulated it with a special saffron extract that has a ton of clinical evidence showing it's as effective as SSRIs for mood support, but without the side effects. The feedback has been insane. More calm, sharper thinking, deeper focus without jitters, and even restful sleep with resilient mornings. One person told us, I'm a machine on this Brainbow, and another said they were actually crying because their brain felt so clear. If you want to experience it for yourself, head to mindfulmeds.io and use the code WILDMIND for 15% off your first order. Details are also in the show notes.
A long time ago, before medicine had developed in a lot of ways, that was the role of the family practitioner or the general practitioner of your GP, was to be the overseer, like the project manager of your healthcare, basically, to make sure that they were like helping people talk to the specialists on your team talk to each other and make sure you're getting your yearly tests done and like thinking about things in a big picture way, in a way that, you know, someone who's ultra specialized in that section of the brain can't, or doesn't have the time to, or doesn't have the training and the opportunity to. So yeah, I think it's really important. And as much as I really see value and appreciate and enjoy doing a lot of focusing into mental health and trauma and how that all shows up in people's bodies, I work hard to keep one foot in the primary care space to be able to not lose sight of the big picture, because I think if my job or my goal and your goal is for you to feel better, that's the only way we're going to get there. If I just continue to pigeonhole myself in the way that other doctors have to as well, then we're losing that big picture lens. I'm the person who's like over here drawing mind maps about how all this stuff is connected so we can figure out, okay, what's going on here? What is the appropriate starting point for this treatment plan, and where do we have to go? And a lot of the times that is referrals out. Okay, one section of this treatment plan is you need to go and see this other clinician so that they can assess you for this or prescribe this or whatever. Or we need to prescribe temporarily these medications. So I'm a big fan of the collaborative care model.
Yeah, collaborative. I wish that there was less dogma in all of the systems, because I know every system has a level of it. We see it a lot more in the traditional medical system. And it's frustrating because there is value in all of it. And I'm guilty of it myself, where in the past, I shunned one of the directions where I was just like, no, I don't want to be on any pharma. Chemicals are bad. And for good reasons, right? Because there is a lot of stuff in the background that's going on that isn't necessarily good for human health. But again, that balance and collaboration, I think, would just change things so dramatically for people. I remember there was a woman who came, and it's so sad. Like when I was in the hospital, there were people that would just come in. It was like a revolving door, right? Like they had been there before, they're at their wits' end. And like when we talk about having a healthcare team, like that's a privilege, right? Because there are some people who can not afford that and they're at their wits' end. This one woman, she had lost custody of her children because her body hurt and she couldn't function. And her last resort was going to the psych ward, which she's been before, and they just pump her full of gabapentin. And it's just, I don't, it's really frustrating and hard to watch. So it is, again, a privilege to be able to work with multiple practitioners. But I don't know. I hope for a world where we start to see more of this collaborative effort that is all under our healthcare system.
Yeah, you and I both, for sure. That's what we're out here trying our best to do.
Yeah. Ah. Okay, so I want to ask you a question, and we had talked about this on the community call that we did for Mindful Meds, but I want to talk about the difference between mental health and nervous system. And I know we already talked about this because you were talking about the nervous system and trauma and these physical symptoms, these ailments that people can experience. But then we also have what I would consider like mental health issues, where somebody has like schizophrenia or bipolar. Is it just all the same thing, or do you think those things should be like separated, treated differently? What do you think there?
Yeah, I think it's a great question. I don't think I have the be all end all answer here, but in general, how I conceptualize it is that mental health challenges are the experience of mental emotional distress in whatever way. It could include things that disconnect people from reality, like psychosis, dissociation, as we see in schizophrenia or in PTSD or in bipolar disorder sometimes, but also includes disruption in your ability to be able to engage in the world from a mental and emotional way, whether that's as a product of anxiety, depression, OCD, whatever. The nervous system is a big umbrella that accompanies mental health as well as many other things. Like the nervous system is ultimately in charge of every single thing that happens in our body and mind. And so I think that there are absolutely people who have mental health challenges, and the primary focus or issue or dysfunction is in the way in which the brain is creating interactions that result in this kind of dissociative or psychotic behavior or whatever it is. I don't think that we have at all exhausted our understanding of the origins of those things. So I absolutely leave lots of space for the possibility that sometime in the future we will have physiologic or physical explanations for these things. But as it stands right now, we have physiologic and physical explanations for definitely some mental health stuff. And so I think that all mental health things need to be evaluated in the context of the nervous system. And a treatment plan needs to be built that addresses both the mental emotional symptoms and distress as well as the potential physiologic causes of these things. We could take anxiety as a really common and also simple example. Like when you look at anxiety purely from a mental health perspective, it gets assessed as like overdrive of behavior, like at a neuronal level, or imbalance in certain neurotransmitters, all of which is a pretty reductionist assessment of anxiety. But nonetheless, like it gets treated as you've identified with SSRIs or other anti-anxiety medication, which is useful symptom management and is life-saving in a lot of cases. And I prescribe those drugs often. Like I am not an anti-drug person at all. But I think that the thing that is really commonly, I would propose in the vast majority of clinical assessments and in doctors' offices across the world at this point, is that people are not looking for the physiologic potential explanations for anxiety, which has a long list of really common things. If you're not eating enough protein, if you are not getting enough sleep, if you're drinking too much caffeine, if you're iron deficient, if your thyroid levels are disrupted, if you've got too much histamine in your body, if there's a laundry list of things that are actually pretty common. A clinician would prescribe for anxiety is not going to do anything to correct a person's iron deficiency or protein low diet. And on the flip side, so they might suppress symptoms temporarily, but the medicine is either not going to work or it's not going to work for very long in those cases. Or maybe even worse, it's going to mask the only symptom expression we have of this otherwise underlying issue that then is going to manifest in other ways, like protein deficient diets or iron deficiency is eventually going to cause someone to get sicker than just, quote unquote, just anxiety. And so if all we're doing is looking at the anxiety through a mental health lens and we're not considering why is the nervous system behaving like that, and then looking at the realities that the mind and body influence together the nervous system's functions, but vice versa, then we're missing a lot. We're missing a lot of causes. We're missing a lot of correct diagnoses, and we're missing a lot of opportunity to help people improve their quality of life and prevent further worsening of disease down the road.
Yeah. I know one of the things that you've prescribed for me is protein, right? And not only for nervous system health, but hormones too, right? I don't know, there's so many ways that we can improve our health through what we're putting in our body. And that's something that I've talked about for a really long time. But yeah, it's so complicated.
Yeah,
It really is.
it is. And to be clear, because it's so complicated and because this is not how I was taught to look at patient care in my training. And I know it's not how conventional docs, GPs, psychiatrists are taught. So I am not being critical of any one individual or any one clinician for not looking at it like this. I am critical of the system for not thinking about it on this level and training doctors to think about it on this level. And I suppose that I'm inviting the individual doctors to start considering things on a bigger picture scale, because whether we were taught that or not, we can choose to shift our perspectives. And I think it's really important. Like, protein is such a common recommendation that I make. And I know the internet is obsessed with eating more protein right now. And certainly there's a spectrum and you can take it too far on a very simple one axis, singular axis level here. Like, you need an adequate amount of protein in order to build neurotransmitters. If we are out here talking about anxiety or depression is neurotransmitter imbalance, which we pretty much conclusively know it's not as simple as that. But even if that's the stance we're taking, okay, then we still need to make sure you've got the building blocks to make a normal amount of neurotransmitters. Or we prescribe you an SSRI, which acts most commonly on the neurotransmitter receptors to keep the serotonin or dopamine or norepinephrine or whatever neurotransmitter we're targeting around, hanging out for longer so that it can act on the receptors for longer and improve your mood. That only works if you have enough serotonin in the first place. And there are many things that contribute to how much you're making. And it's not it's not an easy thing for us to test for, because there's no simple blood test to say, what's your level of serotonin? So yeah, it is really complicated. And if you zoom out and start thinking about things from a systems perspective instead of a single cellular or a single molecule explanation or even single organ explanation, it starts to become less complicated.
Yeah.
In my experience, at least, from my perspective, maybe not.
No, that's a great way to think about it. Can we talk about polyvagal theory a little bit?
Yes.
Let's just polyvagal 101. What is it for people who don't know?
So I'm certainly not an expert, but the theory was coined by Dr. Stephen Porges, and it is basically, the way that I use it in my practice is that the explanation for how and why the mind and body are connected. So prior to polyvagal theory, we didn't really have an explanation for why the body would impact your mental experience or vice versa. And so polyvagal theory really talks about what's happening on a nervous system level that causes mental emotional changes. And also, why does it work in the other direction? Why do mental emotional experiences cause change in the physical body and in the nervous system. So it really helps us to understand the connection between the mind and the body. And also it really helps us to understand varying responses to stressors, whether that's a mental emotional stressor or a physiologic stressor. So polyvagal theory has an incredibly prominent role in good trauma work, trauma therapy, and trauma-informed practice, because it helps us to understand why people respond the way they do. What did it look like when you were in a calm and regulated state under predominantly parasympathetic control? And why is it that the first thing that happens is heart racing, panic, anxiety? And how do we understand that the progression of that is shutdown, dissociation, chronic depression, or like profound panic disorder and dysfunction? So there's like what they call the polyvagal ladder, which walks us through how nervous systems move through those three areas. And the fact that when you are coming out of that state, like a really common phenomenon that lots and lots of clinicians and individuals have experienced, but we didn't have an explanation for until polyvagal theory, is that if you have been super, super depressed or dissociated or disconnected for a long time, as we start to help you feel safe enough and soften enough to be able to return back towards calm and regulated, on the pathway there, you will first feel a bunch more feelings than you were feeling before. And people often in that process, they go from dissociated, which feels like numbness for a lot of people, and they start feeling a bunch of anxiety or fear or worry or grief or whatever. And without a big picture lens and an understanding of what's happening, it would be very easy for both the patient and the clinician in that moment to think that something was wrong, that treatment was making them worse. Mm-hmm. But there are ways that we can assess what's going on, and also an understanding of actually, like, when you thaw, there has to be a release and an interaction with those feelings that your brain was trying to protect you from by dissociating you in the first place. So in order to get to calm and regulated, we have to move through the feeling space. And it informs a lot of trauma recovery and addiction recovery that myself and colleagues in this field do, is a serious commitment to the fact that if you want to get out, you have to go through it. The only way to get out of the difficult experience is by feeling the feelings that are creating the difficult experience and allowing that to be processed and released by your body. There is no way to get from pure panic or pure dissociation back to calm and regulated without understanding that middle step of why did you end up in that significant state in the first place. And so polyvagal theory talks about that and explains that on a nervous system neuroscience perspective, basically.
Yeah. Yeah, it's interesting. I took a course while I was in the thick of things. I think it was before you and I met, and there was a lot of education from this lens. And a lot of the exercises were about going into your symptoms and into the uncomfortability and all of that. And the whole premise was not to feel better. It's just to be okay with not being okay.
Yeah.
And this is something that I've talked about on the podcast for a long time, right? It's like this building of resiliency and facing hard things and being able to go into the underworld and come back out was not easy, but there were times where I could have a little bit of calm. They didn't last very long because my system was just so fucking fried that, yeah, I needed some extra help. But I can see how those techniques, for anybody that is not quite that blown out, it's really interesting. And I even remember like having moments where I felt at home in my body while all of these crazy things were going on. It's like I could find this like little place of safety inside me and almost be able to fall asleep, because I couldn't sleep for months without so many drugs. But yeah, it was interesting. I don't think I'll ever forget that experience, because even when you're experiencing hell, like if you can find that little bit of safety within yourself, there's a shift.
Yeah, absolutely. that safety is the name of this game, and it underscores everything we do when we're appropriately caring for a person from a nervous system lens. And one of the most fundamental concepts that I talk about in this work on any type of recovery journey, but especially trauma recovery, addiction recovery, whatever, is the concept of distress tolerance, which is the capacity of one's nervous system to tolerate the distress of a discomfort of any type, whether that's emotional or physical. And from my perspective and from my 10 years of experience in this work so far, the capacity that one has for tolerating their own distress is very linearly correlated to their ability to recover. And so when we are on a recovery journey, one of the things that we are really targeting is how to safely teach your nervous system that you can experience distress without it being dangerous. And that's, I think, the scientific explanation for that experience that you're talking about is, how can I simultaneously be experiencing all of this pain and discomfort, but also feel some semblance of safety in my body? And it's by helping your nervous system to understand that sometimes pain and distress and fear and panic and whatever are actually genuine indicators that you are in danger. But more often than not, especially in adulthood, especially in our modern world, they are not indicators that we are in danger. They are indicators that we are experiencing distress. And because our nervous systems evolved thousands of years ago in a very different world than we live in now. And so back then, we wouldn't really experience those symptoms unless we were actually in danger. But that's not the case anymore. And distress tolerance and development of that, which is, there are many steps to developing or expanding one's distress tolerance. But it's really fundamentally about being able to experience that distress, whether it's some amount of pain or anxiety or grief or whatever, and feeling and trusting and knowing that you are still safe through that process. And it is a very paradoxical experience, because if you are trying to get rid of, quote unquote, get rid of or get out of that feeling, feels like turning towards it is the last thing you should be doing. And it is actually the only thing that will get you out of it. And what you said a minute ago, I really agree with you. So like, the goal here is not to feel better, it's to just feel. And paradoxically, like, when you commit to just feeling, very often that is the thing that helps you to feel better. But if you're trying to feel better while trying to avoid feeling at all, you're not going to get there.
Yeah, yeah, absolutely. Like, there's a huge difference between numbing out and like avoiding the pain.
Yeah.
And I know in my case, thankfully, I was able to get on some medication that could just suppress the symptoms enough that I could like do the work and like really, because at that point, like, it was just so bad. And I actually, let's discuss that. Or were you going to say something?
Yeah, just one thought, which is, because this is, I think, the most effective way to use psych meds, and the least understood layer is that, and this is why I like them so much, is because in acute moments like the one you were in a year ago, they can effectively expand your capacity to tolerate distress. They can artificially expand your distress tolerance, which is necessary for us to be able to do the work that's going to help you to get out of that state and then maybe not need those drugs down the road. And so people, understandably, both clinicians and patients alike, really often only think about psych meds as tools to suppress symptoms. I think about them in most cases, especially in the ones that you're going to be interacting with for anxiety, depression, panic disorder, distress, or whatever. They are not suppressors when used at low doses. They are tools to expand distress tolerance. And that's actually a much more effective use of them than super high dose that just numb you out, because that's not going to help you to build the skill set that's required for long-term distress tolerance. But as you experience, like, if you are so maxed out or your bucket is so close to full, you don't really have the capacity to learn those new tools. And so we need to give you an artificially bigger bucket, the medication, so that we can use that extra space to start helping you learn how to turn towards your feelings, feel them, let them go, move through it, et cetera, et cetera.
Yeah. And I think a lot of times, like, these medications are prescribed as your brain is broken, right? Because there's no understanding of trauma or any of the other things that we've been discussing. And you have to be on this for life. Yeah. And I remember like doom scrolling while I was sick, because I'm looking at I'm just at the point where I'm like, I can't go on this anymore.
Yeah.
Look at medications. And of course, me, like, I'm doing my own research, which is like the worst thing that you can do in this state, by the way. But I'm reading all of these reviews from people and scaring the shit out of myself because there's people who
Yeah.
go on these meds and they're not doing the work. They just go on stuff and they have to take this super high dose. And then years later, it stops working and they have a huge crash and they're just going from one med to the next and whatever. And I'm just like, oh my God, I was so scared, right? Because I'm like, oh my God, was it me?
Yeah.
But it doesn't have to be like that.
It doesn't have to. And I want to make it clear that I am not, and I don't think you are either, like vilifying people that aren't doing the work.
Yeah.
I think most people who aren't doing the work don't even know what that means.
They don't even know. Yeah.
Because they don't have the opportunity or the privilege to be able to learn about this stuff. And there are absolutely times and places, chapters of one's life where you can't do the work. Like you've got a newborn or you're working 3 jobs to keep food on the table. So I am very much approaching this from like it's a privilege to be able to do this work. But I think that the failure often is of the system that teaches clinicians or then the clinicians themselves to explain that, hey, there are other options here. Yes, one option is that we use these drugs to suppress your symptoms for the rest of your life. And that works for some people. And I have no judgment about that. And if that isn't what you want, there are other options. There are ways to use these medications in conjunction with comprehensive integrative therapy that will help you to maybe not need these drugs down the road or maybe be on them at a lower dose, but have a much improved quality of life. And that's really what I'm out here trying to proselytize about is, okay, if you want the drugs, I'm all in support of that. And that is not the only option.
Yeah. Yeah, absolutely. Let's talk about central sensitization a little bit. Yeah. So that's pretty much what like my diagnosis, like my medical diagnosis would be. And it's so interesting because I wanted to discuss some of the physical symptoms that people can experience while nervous systems are doing what they're doing. When I first had my first episode, like I'm very experienced in panic attacks. Like I started getting them quite young, was put on a medication for them. It suppressed everything, didn't do any of the work. Stuff probably came back later in a different form, right? But this wasn't that. It was so different. Like I would have these strange sensations of like my stomach falling out. I would get woken up in the middle of the night out of a dream and just be feeling like I would have diarrhea, like my stomach was all messed up. And I would just try to calm myself and be like, okay, body, like I'm just clearly processing something and everything's going to be okay. And I did all of that from the beginning, but things just got worse and worse until I got to the point of my vision glitching out and like these internal tremors and like entire muscle groups twitching, bugs crawling, like the feeling of bugs crawling all over my body, and diving into communities of people where they're dealing with similar things. I'm just like, holy shit, like how often is this happening? What is this? Like, how does somebody even get to this point? It's just, yeah, I don't know. I feel like it's happening a lot more
Yep.
than people realize.
Yep.
Yeah.
I think that it is happening a lot more than people realize. And it's also happening more now than it was
Yeah.
years ago.
Yep.
There are so many rabbit holes that we can go down in this category, but Central Sensitization Syndrome is a diagnosis of exclusion, which means it's a fancy way of saying that we don't have any way of actually testing for this condition. And we also don't have any way of explaining what else you're experiencing. And so the only way technically you can get a diagnosis of exclusion, which would also include ME, CFS, POTS, dysautonomia, currently MCAS, although that one's got some measurable stuff that we're developing, is by ruling out every other possible explanation. And so it is basically doctors saying, we don't know what else is wrong with you, so here's this label of anytime anything has syndrome at the end of it, it is like an assessment of, okay, this is just basically shorthand for all of these symptoms that you have, but it doesn't convey the cause.
Fibromyalgia 20 years ago.
Yes, exactly.
Yeah.
And that does not mean that the condition is not real, and it does not mean that the experience the patient having isn't real, but it does mean that we don't fully understand what's going on. And it likely, for anyone who pays attention to medical science, means that 5 to 20 years from now, we're going to have a better explanation for this.
Yep.
And we are seeing that right now. There's a lot of really cool, nascent, like cutting edge research happening, attention happening around POTS dysautonomia, MCAS, which is mast cell activation syndrome, because a lot of that stuff got triggered by COVID and long COVID. And there's tons of research going into what's going on with long COVID, because it's a decent percentage of the population. And it's basically giving many people at a much, much larger population scale a lot of the same symptoms that were previously diagnosed as ME/CFS, Central Sensitization Syndrome, CSS. So now, for better or worse, more people are paying attention to it, and it's resulting in more research and more understanding. And we're seeing that there's a lot of overlap between these conditions and mast cell activation syndrome, which is an immune system dysfunction, behavioral dysfunction that has strong interplay with the nervous system, and POTS or dysautonomia, which is cardiovascular dysfunction at the interplay of, or with the interplay of the nervous system, and leaky gut and IBS and all of these things, which are mucous membrane and vascular issues at the intersection of the nervous system. So basically what we're talking about here is the nervous system and how other body systems interact with that. And so the question of like, how does somebody get to that point? And like, why do some people develop CSS or long COVID or any of these things more than others is certainly an area of like a hot area of research. And the theory is genetics, which is why some people go through what you went through and end up with a laundry list of diagnoses, and other people end up just with depression and they get a heart attack at 50. And there's various ways that our bodies respond to chronic stress inputs. It's mostly determined by genetics and also environmental factors and all the other things that play into this. It's complicated, but fundamentally, like all of those symptoms that you listed, both like just now and also when you first came to see me, were like, but that confounded your psychiatrist. These are all very clearly nervous system symptoms. Like the only thing that causes bugs, it feels like the feeling of bugs crawling all over your skin, that's a nerve response. Anxiety or panic is in my body, not in my mind. And it feels different than when I'm like ruminating and overthinking and spiraling about something. And the two can coexist for sure. But lots of people with these conditions have a very clear sense of, I know what it feels like when I'm anxious about something. And this feels like the physical effects of anxiety, but without the mind components. And that's also a really big indicator. Like, this is not just a mental health condition. This is a nervous system condition that has manifestations in both the physical body and the mental health realms.
I have a theory.
Okay. So
this makes complete sense, but our vast access to information now, I think, is obviously contributes to dysregulation, but I think also our obsession with the wellness culture in industry right now has something to do with it. I know for me, there was a level of like panic when a new thing would arise, right? Because it's like, fuck, what now, right? And then you're Googling stuff and now you're a little bit worried and da-da. And then, of course, we go through this whole pandemic situation where everybody's freaking the fuck out. And from what I'm understanding, people with long COVID, it's already stressed out, environment's not great, and then you get sick. And that's just like the additional stressor on top that then the nervous system can't hold anymore. I remember I was reading this book. It's called Hope and Help for Your Nerves by Claire Weeks. Did I ever talk to you about this book?
no, I never heard of it.
Yeah, so she's like a psych doc from like back in the, I don't know, whatever they still prescribed. What the hell is that word? It's not benzos, but it's a B word.
I'm not sure. Oh, barbiturates.
Barbiturates. Yes. Yeah.
Yeah.
So that long ago.
Okay.
And she described like a lot of the symptoms that I was having, like heart pounding, the palpitations, like even I had like this crazy pulse in my stomach. Like it was so gross. Like I could just watch it. It's like all of these things were listed. And she would just call it was just called a nervous breakdown back then.
Yeah. Which is, I don't think it's a coincidence that these conditions are more common to present in women. And the fact that we don't have as much research on them as we should. Because I think, yeah, right now it's being called MCAS, POTS, dysautonomia. 5 to 10 years ago, it was being called central sensitization. 15 years ago, it was MECFS. 25 years ago, it was a mental breakdown. 100 years ago, it was hysteria.
Yeah.
All the same things.
Yes.
We're
Yeah.
just coming up with different names for them. And also, as you watch that evolution, we are understanding, we are localizing the issue. Like when we called it hysteria, we thought it was a uterus problem. Even orgasms, which was like, I wish. But fuck, obviously that didn't solve it. And so we've just continued to localize the origin of the issue and increase over time. Or like even the move from calling it fibromyalgia to calling it chronic or myalgic encephalomyelitis, which was like, okay, this is an acknowledgement of the fact, like myalgic encephalomyelitis is explicitly that it's just a bunch of Latin terms that means the intersection between the body and the brain. And so we're just evolving our understanding of it. So we're getting there. There are lots of problems with our current society, and it is the best we've ever had it in terms of access to resources and access to information and research and medicine and healthcare and all that stuff. And I will be the first to list all the problems, but I think there's a lot that is working. And I think your theory is fascinating. I would propose an opposite theory, which is that I think that our current obsession with health and wellness, while it can be dysregulating in a moment to an individual, I think that's a symptom of the fact that a lot of people are struggling.
Yeah.
And a lot of those people are women who have been struggling for a century, but this is one of the first generations where they feel like they're allowed to talk about it and that some people are actually listening. And I'm certain that you've got tons of experience and can think of other people's stories of how many countless times women and their symptoms and struggles are dismissed or discounted by physicians. And it happens an abhorrent amount of time. And it is still happening way less than it was happening 5 years ago. So the more that people start listening to people that are struggling, especially when it's often women, especially when a lot of the symptoms are mental health related, which is historically a thing that we would dismiss, like people paying attention to it now for the first time. It's that question of, do we have more of these conditions now because something about 2025 is causing this? Or is it that we are paying attention and diagnosing it more accurately now? And it's the same question we have for allergies and asthma and autism and a million other things.
Yeah. Yeah, because this has been happening for a long time. Like I was reading a biography of Emily Carr, one of my favorite artists. And her description of her time in, what did she call it? It's called a sanatorium, which sounds like a psych ward, but it's not. It's like a place where you go that's like
a recovery ward. Yeah, they started for recovery from tuberculosis before we knew how to treat it.
Oh, yeah. So it's like fresh air and like good food and all of the things.
Yeah.
So she's describing to like, not in a lot of detail, but from what she's explaining, I'm just like, yo, like this is her nervous system. Like cursing her legs, like darn legs, like why won't you just walk? And becoming ill after having an accident, falling down the stairs. All of these things where I'm just like, and they had no idea what the hell it was at the time. And I'm sure, I don't remember her having a diagnosis of hysteria or if that was even the case back then, because it wasn't that long ago.
Yeah.
But yeah, it's crazy. And the type of care that women were getting in the past, I don't even want to think about it because it's like lobotomies and just absolutely horrific things.
Yeah.
We're getting somewhere.
We are getting somewhere. There's a long way to go, and I am very glad to have been born the year I was born. Yeah. And not.
The health problems that I've come in with, I'm dead from strep throat at the age of 7. Like,
You and me both. Yeah, for sure.
Oh my gosh. We're at the end of our time already.
Crazy.
Yes. Let's wrap up with, let's do one more question. What is one thing you wish everyone knew about nervous system healing?
I wish that everybody knew that the path to healing for most things is that you have to start building a relationship with your nervous system, which means starting to recognize that sensation like pain or fatigue or heaviness or overwhelm or emotion, distress, grief, anxiety, depression, whatever. These are messages from your nervous system to you about what you need more or less of. So we have in society and in medicine unfortunately created a situation where we place value judgments on these things. Oh, you have pain, you shouldn't have it, let's suppress it. Oh, you have anxiety, you shouldn't have it, let's suppress it. And if we can instead look at all of this as just information, value neutral information about what we need more or less of in our lives, in our bodies, in our day-to-day, in our environment, you can start taking control of your physical and mental health and start to feel like you are working with your body instead of like your body or your mind or both are just like going rogue and doing whatever they want separate from what you want, which creates a lot of internal distress and fear and a lack of safety. And yes, we're going to get improvement in trauma responses and improvement in physical health by starting to work with your nervous system and learn how to speak its language. Like a thing I say all the time is you can't have a healthy relationship with someone if you don't speak the language they speak, because communication is the central tenet there. And that's the same thing with our nervous systems. We have to learn how to speak its language. And one of the reasons why I love this work so much is that on the way to us learning how to interpret your body's signals, yeah, you're going to feel improvement in your PTSD or your CSS or your MCAS or your fatigue or your insomnia or whatever, but you're also going to end up being able to have a stronger connection to yourself and an easier time saying yes to the things you want and no to the things you don't want, which translates to like stronger boundaries and more clear decision making towards building the life that you want. And so everything is really all connected, but it starts from starting to listen and starting to pay attention and learning how or asking for help to learn how to interpret those signals, because the information is being given to us. We just have to learn how to interpret it.
Yeah. Yeah. Said.
Thank you.
Okay. I'm sure everybody listening is going to want to get in touch with you or at least follow you on Instagram. There's a ton of great content on there. How can people connect with you to learn more, maybe work with you?
Yeah, so Instagram is probably the easiest way to connect with me at Dr. Jessica Eastman on Instagram, Dr. Jessica Eastman. My website is drjessicaeastman.com. The contact form on my website goes directly and exclusively to my email inbox. Nobody else is going to read it. So if you have questions or you want to work with me, there's lots of information on my website and on my Instagram, and you can connect with me via the contact page. That stuff is also always evolving. My private practice is in Vancouver, British Columbia. So anyone who has boots on the ground in British Columbia, whether you're a resident or you're visiting, can work with me and my medical practice. And if you live outside of the province or outside of the country and you want to connect with me, there are some options that we can do non-medical work together. And that would be a good thing to drop into my email inbox about.
Wonderful. Yeah. And like I said, our very first phone consultation was via the psych ward and like completely non-judgmental.
Yeah.
I felt so seen.
Oh,
Yeah, I will never forget that. You're just like, you don't scare me and you're going to be okay.
I'm so glad. That is definitely the goal.
Yeah.
Yeah.
Wonderful. Thank you so much for this conversation. It's so enlightening every time we have these discussions and just even me learning more about my nervous system all the time is just bringing me to more resiliency in all parts of my life. So I hope everyone can dive into this work further because it's helpful for everyone. So make sure you give Dr. Jess a follow on Instagram. Reach out if you need support because she's absolutely phenomenal. And Yeah, maybe we'll have a part 2 at some point.
That would be great. I'm sure we've got hours more stuff to talk about.
100%.
Thanks, Krysta. It was really wonderful to be here.
Yeah, thank you. And thanks everyone for listening. We'll catch you on the next episode. If this episode cracked you open, good. Share it far and wide so we can reach more people who are done pretending and ready to come home to themselves. And remember, if you leave a review on Apple Podcasts or tap the stars on Spotify, you'll be entered into my monthly draw for a bottle of my medicinal herbal oil. It's my way of saying thank you for helping this work reach more people who need it the most. I'll announce winners right here on the show. To dive deeper into my world, explore wildcrafted apothecary and sacred art at magicmaven.com. Discover new tools for nervous system healing at mindfulmeds.io, or bring your vision to life with me at the Brand Bruja. All the links and more are waiting for you in the show notes. Until next time, stay wild, stay rooted, and remember, you were made for this.